Chapter 11 of ICD-10-CM is for diseases of the digestive system. As there are currently no official ICD-10 guidelines specific to this chapter, we will focus on clinical scenarios specific to the chapter, followed by a small quiz at the end of the presentation. For each coding example, you will need to pause the webinar and use your ICD-10-CM coding manual to code the scenario. Once you resume the webinar, we will go over the correct codes, the rationale behind them, as well as how to locate them in the ICD-10 manual. Keep in mind that there may be more than one way to find a code. We are aware that there is a great deal of information contained in this presentation. Therefore, at any time during the webinar, please feel free to pause and replay as needed. It is important that you have already completed the Introduction to ICD-10-CM webinar, as you will use the conventions and general guidelines discussed in the introduction to complete the coding scenarios. As you can see on this slide, the codes for this chapter start with the letter K. If you remember from ICD-9, the digestive system codes all started with the number 5. Though there are currently no guidelines for the digestive system chapter, there are two new sections that we didn't have in ICD-9. These are diseases of the liver and disorders of the gallbladder, biliary tract, and pancreas. In ICD-9, these conditions were not separated out from other digestive conditions, and all fell under the general heading of other diseases of digestive system. Another change from ICD-9 to ICD-10 is that Crohn's disease, which is category K50, now contains combo codes for the site of the Crohn's disease, which is the small intestine, the large intestine, or both the small and large intestine, as well as common complications, such as rectal bleeding, intestinal obstruction, fistula, and abscess. Just like in ICD-9, ICD-10 contains combination codes for ulcers and the resulting complications. You do not need to use a separate code for a complication unless a patient has multiple complications. Besides, for example, acute gastric ulcer with hemorrhage and perforation, which is code K25.2. As you can see, the code tells us that the condition is acute if there was hemorrhage and perforation, and of course the site of the ulcer. Now I'd like to try some examples. First, we have a patient that has been treated for Crohn's disease of the small intestine since she was 21. She has had several exacerbations of the disease in past years. At this time, small bowel X-ray shows a small bowel obstruction. The obstruction was found to be a result of exacerbation of her Crohn's disease. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The answer is K50.012, Crohn's disease of small intestine with intestinal obstruction. To locate this code, start at disease in the alphabetic index and then find Crohn's. Here you will see an instructional note which states see enteritis regional. After you follow these directions and are at regional under enteritis, find small intestine, then the word with indented below, then complications, and then intestinal obstruction, as documentation states that the X-ray showed a small bowel obstruction. This points to K50.012, which you would then confirm in the tabular. The next example was taken from a real note. The assessment plan states severe Crohn's disease of small intestine, stable, off of steroids and now on maintenance Cimzia. Iron deficiency anemia, improving, despite being on Remicade but now on Cimzia. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is K50.00, Crohn's disease of small intestine without complications. If you remember from the previous slide, Crohn's disease can be found in the alphabetic index under enteritis, regional. You would then look for the specific location of the Crohn's, which in this case is the small intestine. Since the Crohn's is stable and therefore no complications are present, The code next to Crohn's of the small intestine is K50.00 in the alphabetic index, and then you would confirm this in the tabular. The second code is D50.9 for iron deficiency anemia unspecified. To locate this code, you would start at anemia in the alphabetic index and then find iron deficiency, which points to D50.9, which you would then confirm in the tabular. Let's do another example. Our patient is seen for treatment of a recurrent right inguinal hernia with gangrene and obstruction. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The answer is K40.41 unilateral inguinal hernia with gangrene recurrent. To locate this code, start at hernia in the alphabetic index and then find inguinal. From there, locate the term with, then gangrene, and obstruction in parentheses, which points to K40.41, which you would then confirm in the tabular. You'll notice that even though documentation states that the hernia was on the right, there are no options for laterality. So you want to make sure that you use the code for unilateral, as documentation does not state that this was a bilateral hernia. For the next example, we have a patient that has been diagnosed with choledocholithiasis with acute cholangitis and obstruction. Choledocholithiasis, one of my favorite words, is calculi in the gallbladder and common bile duct. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The answer is K80.33, calculus of bile duct with acute cholangitis with obstruction. To locate this code, start at choledocholithiasis in the alphabetic index where there is an instructional note which states see calculus bile duct. After you follow these directions and are at bile duct under calculus, find the word with, then cholangitis, then acute, and then the word with indented below, followed by obstruction, which points to K80.33, which you would then confirm in the tabular. For our last example, we have a SNF patient with extensive cellulitis of the abdominal wall. The exam reveals that his existing gastrostomy site is infected. He had a feeding tube inserted 3 months ago because of carcinoma of the middle esophagus. The physician confirmed that the responsible organism for the infection is Staphylococcus aureus. How would you code this? Please pause the webinar to complete this example, then hit play to continue and learn the answer. The first code is K94.22 for a gastrostomy infection. This condition is coded first as it is a complication. To locate this code, start at complications in the alphabetic index, then go to gastrostomy, then infection, which points to K94.22, which you would then confirm in the tabular. In the tabular, there is a note which states, use additional code to specify type of infection, such as cellulitis of abdominal wall, L03.311. Since cellulitis of the abdominal wall is documented, L03.311 is our next code. If you did not see the instructional note, to look up this code, you would first go to cellulitis in the alphabetic index and then locate abdominal wall indented below, which points to L03.311, which you would then confirm in the tabular. We're not done yet because documentation also states that the organism responsible for the infection is Staph aureus. This codes to B95.61, methicillin susceptible Staphylococcus aureus infection as the cause of diseases classified elsewhere. To locate this code, start an infection in the alphabetic index, then locate staphylococcal, and then indented below is as cause of disease classified elsewhere, and then aureus, which points to B95.61, which you would then confirm in the tabular. Our final code is C15.4, malignant neoplasm of middle third of esophagus. As documentation states carcinoma of the middle esophagus, you would start at carcinoma in the alphabetic index. There is a note which states, see also neoplasm by site malignant. Therefore, you would turn to the neoplasm table, which for the Optum 2015 ICD-10-CM Expert for Physicians starts on page 321. You would then locate the site, which is the esophagus, then find middle indented below. You would then look to the right in the malignant primary column, as our direction at carcinoma stated to use malignant, and we are using primary because documentation does not state that the cancer metastasized to the esophagus. Therefore, our code is C15.4, which we would then confirm in the tabular. Now it's time for our quiz. Our first question is true or false. The only new coding guideline for this chapter is that stomach ulcers always require at least 2 codes. The second question is what does the 6th character indicate in category K50.01? You can pause the webinar to write down your answers and then hit play to find out if you were correct. The answer to our first question is false. There are currently no coding guidelines for this chapter. That was a bit of a trick question. The answer to the second question is the 6th character indicates the type of complication present with Crohn's disease, such as rectal bleeding. You would have had to turn to subcategory K50.01 to find this answer. Remember, the United States will begin using ICD-10 on October 1st of 2015. After the October 1st compliance date, it will be very important to verify that claims are being received and to check remits for denials based on the ICD-10 conversion. This concludes Chapter 11 of ICD-10-CM, Diseases of the Digestive System. Please feel free to check out our webinars on all 21 chapters of ICD-10-CM. If you need further assistance with ICD-10 training for physicians and/or staff, please visit the VantagePoint website at www.vantagepointconsult.com or call us at 203-288-6860.